Welcome to Medicare Lagniappe, where we cut the confusion on all your Medicare-related questions and cover topics plus real-life scenarios to empower you for a better understanding of your Medicare options today.
Welcome to Medicare Lagniappe, Fussell Group's premier site of learning everything about Medicare. My name is Caroline Badon, and today I'm here with Cindy Schneida, a licensed insurance agent with the Fussell Group. But today we're doing a little plot twist, and instead of talking about Medicare, we're going to talk about ACA Health Marketplace Insurance.
All right.
So thank you for being here.
You're welcome.
All right, so let's start from the very beginning. We're going to act as if I need this, and I am just doing a Q&A with you. So my first question for you is, who qualifies?
So anyone under 65 that's not on Medicare could qualify. If they have work coverage, then they would get coverage through work. But if you're self-employed or for some reason your job doesn't offer you coverage, then you could get a policy, a health insurance policy through the health marketplace.
Are there any specific qualifications based on like where you live or anything like that for the health marketplace?
So every parish, zip code may have a different policy that's available to them, but it does not matter if you have pre-existing conditions, you have to be accepted on the plan. So if that's a concern, I've had a heart attack before, or, some other medical condition, or take a lot of medications, none of that matters. You have to be accepted on the plans.
As long as you live in the United States, correct?
United States citizen, not incarcerated, yeah, so those are the few things that may limit you or exclude you from being able to have it. But yes, living in the United States, being a United States citizen.
So I qualify for all of those things. When can I enroll in a health insurance plan?
So there's different times of the year. Most people enroll during the open enrollment period. That starts November 1st and it ends January 15th. Other times during the year, they have special enrollment periods. Say you've moved out of that planned coverage area, you have a baby, you lose work coverage. There's various things that would allow you to enroll other than that time of the year.
Okay, if I'm offered insurance through my employer, can I still enroll?
If it's considered not affordable, there's a calculation that we have to do to determine that, but most of the time you do get it through your employer.
So I know that we spoke about pre-existing conditions and they have to accept you no matter what, but does it make the premium any different? Like what I would be paying monthly for my health insurance, would it be higher if I'm sick? Like if I have pre-existing conditions?
No, so that's a great part about this. It is based on income, number of members in the household. So if you have a lot of medical costs, that does not eliminate you or disqualify you from one plan over another. So none of that makes your premiums higher because you have, something that you're dealing with.
That's good news.
Mm-hmm,
So
absolutely.
What are some things that a health marketplace plan would cover?
So they have actually some services or procedures that you would normally get. They call them preventative services. Those coverages, you don't have to meet any kind of deductible for that. They're at zero premium or zero cost to you to be able to get these covered services. Women, it would be like mammograms, colonoscopies, just those preventative things, your annual visit, that you don't have to meet a deductible for that.
Okay.
Yeah.
So if I fall and break my leg and I need to go to the emergency room, what do they cover in that instance?
So it depends on which plan you have, as if you would have a deductible first. Some plans have a higher deductible if you want a lower premium, or if you want a lower deductible, then you would pay a higher premium for that. It gets covered just like if you would have private insurance. It is actually through private insurances that companies that you would have your plan. The government just subsidizes the cost of the premium. That's why you can get it lower.
Okay, so let's take it a little bit of a different route. Prescriptions. If I am on certain prescriptions, how do I get coverage for that? How do I know what is covered, what isn't covered, things like that?
So that's what you would do with an agent. An agent would be able to look at your medications and plug it into each plan and see, okay, you get it covered on this plan for this amount. No, it's not covered on this plan. That's what I do. I sit down with people. I get a list of their medications, get a list of their doctors. I want to make sure that the doctors that you're seeing are in network. I don't want you to have unexpected costs because your doctors are not in the plan that you have chosen.
Right. So sitting down with an agent just kind of takes the legwork off of the client. You know, it's not really something they're comfortable doing. They don't do this every day.
Exactly.
So it's really just easier for the agent to guide them.
Exactly.
Make sure they're choosing the right plan.
You can actually do it on your own, but I don't recommend that. There's so many ins and outs and questions that you may not know the answers to that we can help you out with that.
Right. What about extra things like podiatry care, the chiropractor, occupational therapy, physical therapy, things like that?
So yeah, they would have coverage for that. You can add additional coverage for like dental, but most of the plans do not include dental except for children under 18, and then it's included with that.
Okay, so if I'm 26, get on a specific plan today that didn't have dental, I would just get a standalone dental plan.
Yes, you can add that at that time when you're enrolling on the medical plan. You could add dental insurance at that time as well.
Great. It's super important to have dental insurance.
It is really. You
Teeth
don't
are
realize
expensive.
I bit into a sandwich and I chipped my tooth.
Oh.
I know. I'm like, well, thank goodness I had dental insurance because who knows what that would have cost.
Yeah, teeth are expensive. All right, so tell me, what are advanced premium tax credits?
Okay, so that's where the complication comes in. So I didn't know any of these terms before I started doing this. And most people, there's just not something in their vocabulary. So
Right.
The federal government actually subsidizes your medical costs. So if the premium would be, say, $600, they could possibly subsidize that whole amount, or $500, and then you'd have a lower premium with it. And then once you file your taxes at the end of the year, you would put that in there and claim that on your taxes, and they would give you credit for that.
Okay. So another question I have. I know a lot of people in their younger years, before they get married and settle down, they may travel a lot. They may move to a different state. How does that work with these plans? Say I'm going on vacation and I need to see a doctor. What would I do?
So all medical emergencies are covered by the plan, and they'll, take care of you, and of course try and get you back as soon as they possibly can. So you don't have to worry about out-of-network coverage, or can I go to an urgent care facility, or can I go get, I'm not feeling good, I just need to go to the hospital. You can go there, and the plans would take care of that for you.
Okay, well that's great. And then another question: what if I were to just move to another state?
So you would get a new plan in your new state because the plans here would not be effective over there. So that's
okay. So every state has their own plans.
Yes. They do.
Obviously, for the doctors that are in network and things like that, that has to be the case.
Yes, and every zip code or a parish, there's more zip codes in one parish, but every parish has their own plan. So if you would move from one parish to another, your plan may not be available there, and you would get with an agent to change that.
So in my opinion, just, I'm of the younger age group, and some of my friends, will look at me and say, oh, I don't have health insurance.
Yeah.
What's the reason for them why is it so important for them to have health insurance?
Well, that's what insurance is. It's a just in case. So you never know, you're driving along and there's somebody that runs a red light, runs into you, sitting at a stop sign, somebody runs into the back of you. It's unpredictable. Life's unpredictable. And
You fall and break your leg.
Exactly. So, usually the younger aged, people don't have a high premium. It's a low cost premium. I have several that have zero premium for their plans. So why not? Why not get it if you got that protection with you?
Right.
And remember that when you turn 26, you're now off your parents' plan.
That's
so
the catch.
you need to get an insurance plan for yourself.
And that's what a lot of people don't realize is when you turn 26, you're booted.
Yeah.
So you're no longer covered by your parents. You need health insurance. If something were to happen to you and you have to pay these medical bills, do you have thousands and thousands of dollars to pay those medical bills, or would you rather just pay your monthly premium and be covered?
So, even if your premium's $10 a month, $15 a month, the
Right. That's
emergency,
a PJ's coffee.
emergency room costs are astronomical. It really is. So it's better to be safe than sorry. That's what I say.
Yes. So let's just make a blanket statement here. If you are under the age of 65 and you do not have health insurance, the Fussell Group can help you. You need health insurance. Just because
Absolutely.
you're young doesn't mean something can't happen to you.
Oh, I
right?
know. A lot of times younger individuals think they're invincible and nothing's going to happen to, oh, I don't need to
I'm
get,
not going to get sick.
oh, I don't have time for that. Yeah, make the time.
Yeah, it's important.
Yeah,
All right.
absolutely.
Well, Cindy, thank you so much for joining us and
Thank
giving us that
you.
important information that a lot of people just don't know.
Yeah, you just don't think about it sometimes. I'm feeling good. I don't have any health problems.
Right.
I
Not
don't
on
need to
any
worry about that.
medicine. Yeah.
Yeah, absolutely.
All right. Well, that's all for today. Cindy, thank you so much for joining us.
All right, thank you.
If you've enjoyed this video, like and subscribe and stay on the lookout for more. Remember that the Fussell Group has licensed agents to help you in these situations. If you want to just call and chat with someone, it's at no cost to you. So follow us on Facebook, Instagram, and visit our website at fgiala.com. Thanks for watching. This has been a Fussell Group Insurance Advisors educational production series. If you enjoyed this video, like and subscribe and stay on the lookout for more. Please follow us on Facebook, Instagram, and visit our website, fgiala.com.